procedures. The first one is called PRP, or platelet-rich plasma. Okay, platelet-rich plasma is probably the easiest to obtain, the easiest to perform, and it's using basically a sample of your own blood, usually a smaller sample. It's a little bit bigger than a blood draw. It's usually between 60 to 120 cc's of blood, of whole blood. We do that in the office, and then what we do is we use a specialized kit to use a centrifuge to spin the blood down and to separate the blood into different components. Okay, you've got your red blood cells, you've got your white blood cells, you have your plasma, you have your platelets, and you have all of these different components that are part of that. Okay, so PRP is basically concentrating that blood down to the plasma and to the platelet component. Okay, the platelet component, your platelets, we all have billions and billions of platelets in our body. And if we did not have platelets, we would not survive, period. Platelets are these little small cells and cell fragments that basically are designed to heal your tissue. If you get a cut on your arm, the first thing that is recruited are platelets. That's how you form a scab. That's how you stop the bleeding. Okay? It's part of the blood clotting cascade. Okay? And there's multiple factors involved with this and so forth. So platelets are inherently designed to have all of the necessary growth factors and healing factors to heal your body. Okay? So you're saying, okay, well, why can't we just have our blood floating around our body and basically it heals itself all the time? Well, oftentimes it does. You get internal injuries all the time. You get external injuries all the time. Okay? But oftentimes joints, tendons, ligaments, and things like that do not have the proper concentration and blood supply to heal itself. Okay? You don't have a bunch of blood floating around inside your joints on any regular basis. You might have that if you have an injury to it or something like that. Okay? So what we do is we take these platelets and we spin them down and concentrate them down to a certain level or a certain dose of platelets. Okay? Usually that key number is anywhere between 5 and 10 billion platelets, and we are able to harvest that from about 60 cc's of a normal person's blood. Okay? And then basically what we do is we concentrate that down into anywhere between 6 and 10 milliliters or cc's, and then we inject that where it needs to be injected. You can use that for mild to moderate osteoarthritis in hips, knees, or shoulders. You can use it in tendon injuries. You can use it in inflammatory conditions like tennis elbow or Achilles tendonitis or any other tendon or ligament injury or problem that you have. And then you can inject that under specific ultrasound guidance so that you know exactly where you're putting that. Let's say that you have a rotator cuff injury or something like that, and you can inject that PRP in those tendons itself, around the tendons, in the joint. And so basically we focus on providing these healing components to these injuries. Okay? So does anybody have any questions or